Hello everyone, this is Dr. Kim, and in this video I would like to show you a very prominent marrow space that's captured in CBCT. Interestingly, this site also happens to be an area of interest where for placement of an implant, tooth number 30 has been already extracted and also grafted. So why don't we take a look at that first, and then we'll look at the side of marrow space. Over here, let's start out with the sagittal section this time, or sagittal view. You can see the socket, outline of the socket, or lamina dura of missing tooth number 30. Keep in mind this is actually 30, although it appears like a side of number 19. That can be verified looking at the axial view as well as this 3D rendering. So this site number 30, the sockets are filled with graft material, and you can see the border of the graft material beautifully filling the socket and also blending with the surrounding bone. That is also seen here. Here's the graft material, and notice how the bone density, or the density of the graft material, appears different from that of the surrounding trabecular bone. So the way I would assess this procedure is healed and it's beautifully done. The graft procedure is done well, and the socket is fully healed and ready to receive dental implant. Additionally, recently I posted a video of an elderly patient with a thin cortical bone and sparse trabeculation. This is essentially we're seeing a very completely opposite bone density in this patient. Look at the overall thickness of that cortical plate or cortical bone all along the mandible. It's very thick and dense. Additionally, we can see this fine little trabecular pattern a lot more so than the previous patient, who was, if I recall, 80 years old. On top of that, the mandibular canal itself is also well corticated. So this patient is nowhere near being diagnosed with osteopenia or osteoporosis, and we can just tell that from their overall bony architecture and density. So going back to the objective of this video, I wanted to show you a marrow space, right? So if you look carefully between the two sockets, mesial and distal socket, we see a well-defined and thinly corticated radiolucency located right between the two. So let me go ahead and scroll through that. And also we see it in this coronal view as well. And let's see if I can capture that in the axial view. There you go. I think it's easy as a dental student or someone who is still learning to interpret CBCT that this could come across as a very worrisome feature. And I've seen dental students, my own students, considering a wide range of benign lesions for something that would appear as this one. And it could be true that there may be a case of a benign lesion, well-defined corticated radiolucency located between the two central incisors, two roots, and depending on the history of that tooth, it could have been a residual cyst, right? So it's certainly possible. I don't want to rule that out. But in this case, it's very definite to me that this is not a true benign lesion, but rather we're looking at a normal marrow space. There are several features that I look for when determining whether this is a marrow space or a true space-occupying benign lesion. And I first look at the shape and how it's corticated. It doesn't have that spherical, hydraulic-shaped radiolucency, but it's well-defined, but it's somewhat irregular. It doesn't have that balloon-like appearance. And that is even more true when you look at this in this coronal section. It has that somewhat kind of amorphous shape to it, and that's also true in this axial section. It appears to extend to the endosseal surface of the lingual cortical plate, but again, are we seeing any mass effect? We don't. We don't see any evidence of thinning or expansion of the cortical plates. So those are some of the features, and perhaps another feature that that I noticed is that if we look at the inferior border of the marrow space, it shares the same border with the superior cortication of the mandibular canal. Right here, that's the mandibular canal, and shares the same border, and yet again we don't see any evidence of thinning or displacement of the mandibular canal. So those are features that I collect um, to definitively diagnose this being a marrow space. Thank you very much for your attention, and I'll see you in the next video. Bye.